Welcome to Sahlgrenska International Care. Our organisation provides highly specialised care for international patients at Sahlgrenska University Hospital in Gothenburg. This hospital is the largest hospital in Northern Europe, offering the latest medical and surgical disciplines based on Swedish research, know-how and experience. In this film, we'll meet some of the highly distinguished doctors representing a few of the most interesting medical fields here at Sahlgrenska International Care.
Reconstructive hand surgery in tetraplegia is a surgical procedure or a combination of surgical procedures that are providing the individual who has sustained a spinal cord injury with an improved hand and arm function. We're talking about paralyzed patients, patients who have sustained a spinal cord injury and who are unable to move their hands, to control their hand and arm functions. And by doing this reconstructive hand surgery, you improve their quality of life, their ability to maneuver a wheelchair, to control their activities of daily life. And that's a major step forward in their rehabilitation. Anyway, so they have broken their neck. They have sustained a dramatic change of life because they cannot move their hands or arms or legs. They cannot walk anymore. And these patients prioritize restoring or regaining their hand function as number one function, much more than sexual function, trunk stability, bowel, bladder control, walking, even pain is less prioritized compared to hand function. So they really need to be able to be more free, to move, to feed themselves, to do the activities of daily life by a control of their hands. So that's why it's so important to at least give them the opportunity or presenting this opportunity to them.
Queen Silvia's Children's Hospital is part of the Sahlgrenska University Hospital and is the children's hospital with general surgery, medical department, neurology and intensive care unit. And we treat patients with congenital heart diseases. About 25% is newborn, about 60% is under 1 year, and the remaining 40% is 1 year to 17 years. I was 1 year at Great Ormond Street Hospital as a senior surgical registrar, and what comes into mind is that treatment strategies are very similar in Great Ormond Street Hospital and at Queen Silvia's Children's Hospital when it comes to pediatric cardiac surgery. I regard this personally not only as work, and the sense of responsibility for these children is very big. We have a Norwood program, we have a neonatal program, we have an ECMO program, we have an assist program, and we can provide general surgery as well as medical services around the patient if needed. We also have a complete diagnostic program with MRI, CT scan and echo department.
Treatment with pacemaker and ICDs is a highly effective medical treatment these days. However, complications do occur at a very low rate, and when they occur, they need to be treated properly because these complications can be serious. ICD and pacemaker systems consist of leads and devices. The leads are transvenously implanted into the heart. Over time, these leads will undergo fibrotic encapsulation, and it will not be possible to pull these leads out. So, if you have a problem with an infection of the device system, or you need to take out leads that are non-functional or superfluous, you need to use special methods. Instead of having to open the chest, we put special sheets over the leads from where the leads enter the venous system and then down to the heart. We, at this institution, we use all available methods to achieve this. However, the most efficient method to take leads out is laser-assisted lead extraction. If you have an ICD or a pacemaker and you're unfortunate enough to have a lead problem, you need to be treated in an institution with a proven experience to take these leads out.
At Neurorehabilitation at Sahlgrenska University Hospital, we specialize in brain diseases and acquired brain injuries, preferentially stroke and traumatic brain injuries. We have inpatient programs, we have outpatient programs, and we have occupational rehab programs of different kind. Our main focus is directed towards acquired brain injuries, meaning stroke is dominating. About 60-65% of the patients here are having strokes, and around 25% traumatic brain injuries. And then we have a bit of more rare neurological conditions for the remaining part. And that is mostly, I'm talking about the inpatient unit. For the outpatient unit, we have follow-up programs as well. And we have special polyclinics, not only focusing on stroke and traumatic brain injuries, but also Parkinson's disease, polio programs, which is rare nowadays. But we still see a net increase of the polio group because we have the immigration, and polio can still be found in some of Europe's countries actually. I'm very passionate about this area, about neurology and rehabilitation medicine, because we are just on the very, very first part of a very exciting pathway where we can see the linkage between new knowledge about neuroregeneration, plasticity, and coupled to a very, very fantastic clinical development as well.
I'm the director at the Center of Orthopaedic Osseointegration within the Department of Orthopaedics at the Sahlgrenska University Hospital here in Gothenburg. And I work exclusively with a new method that we have developed here in Gothenburg to treat amputees. In principle, what we do is that we have an implant that we put in the amputee, and to this implant we can connect an artificial prosthesis. Here in Gothenburg we are sitting on a very interesting technology which is called Osseointegration, and it's based on the knowledge and understanding that titanium, the metal titanium, can fuse or integrate with bone tissue. This is a discovery made by my father and was originally developed for dental implants. But now, as I'm an orthopedic surgeon, we move this technology to be able to treat amputees.
Sahlgrenska International Care are happy to help with preliminary assessments and provide cost estimates in addition to a number of other practical arrangements in relation to the treatment of international patients.